اوكي، نبدأ يا تامر. بدينا الريكوردينج.
Okay. Um, Good evening, everyone. Welcome to our session for today, titled Academic Medicine Opportunities in Ireland. We are very pleased today to have two of the amazing faculties to speak about this topic today. We have Dr. Thamir Mahgoub and Dr. Mohamed Elhassan. Abdullah. Um, Dr. Thamir is a consultant of medical oncology in University Hospital of Limerick, and is also a medical tutor in School of Medicine, University of Limerick. And Dr. Mohammed is also a medical oncologist, and he is Associated Professor of Medical Education and a course director of Master of Health Profession in School of Medicine, University Hospital of Limerick. Um, we're very pleased today to welcome them to the session. And I think there is a lot of question needs to be answered about the academic opportunities in Ireland, specifically for people who want to pursue a full academic career, and also the importance for academic degree for people who wants to pursue a full clinical job. So I'll leave the mic to Dr. Thamir today. He's going to start first. So welcome, Dr. Thamir.
Assalamu alaikum. Thank you, Dr. Hassan, for the kind introduction, and SDUI for the invitation. So I am a medical oncologist, and like Dr. Hassan has said, I am currently a clinical tutor with the University of Limerick. So topic for today is academic opportunities in medicine in Ireland. And what I'm going to go through are mostly two aspects. One is the clinical tutor role, and second is postgraduate degrees. So I'm going to share my screen. Just let me know if you can see my screen. Can you see my screen okay?
Yeah, I think it's clear here.
It's clear.
Yes.
Perfect. Okay, starting off, what is academic medicine? Academic medicine is the discovery and development of basic principles, effective policies, and best practices that advance research and education in health sciences. The ultimate goal here is to improve the health and well-being of individuals and populations. Setting is mostly in medical schools and affiliated teaching hospitals. There are three aspects to academic medicine. There's service or clinical aspect, and that can be done in a teaching hospital or can be out in the community. There's education aspect, which is teaching undergraduates, postgraduate students, but also kind of self-development, such as postgraduate courses and research. So the last aspect is research, and this is something that can be conducted while in your clinical job. So that be clinical research or can be laboratory based as well. At any stage, you can have a combination of those. So you could be as an NCHD or a consultant working in a role which combines, which is solely focuses on one of these aspects, but can combine two or more of these roles. And this can be done as a full-time, part-time, or you can get sometimes consultants who have a 50-50 combined clinical and academic role. So next question is why why choose or consider a career in academia? So we mentioned that one of the aspects is education, and this can be something that's very satisfying in terms of teaching the next generation of physicians and scientists. Other aspect is research, especially when it leads to improvements in patient care and addressing community needs. And then in terms of your role as a hospital doctor or a GP in the community, trying to provide the best and highest quality of care possible to your patients. Within all of these, kind of the common threads or aspects are a variety of the work that's involved in academia, the intellectual stimulation that it gives, the service and the fulfilling relationship that develops, especially with networking between and within departments. Sorry. And again, there are many other reasons to choose or consider a career in academia. One of them is personal development and career progression, personal satisfaction, as mentioned, networking, but it also gives you a chance to improve your knowledge and clinical skills in medical education, conducting clinical research, laboratory-based research, and kind of improve your knowledge in relation to your own clinical specialty as well. Academia generally offers flexible hours. There is protected time for research, for reading as compared to a full-time clinical job. And you might want to choose or consider academia as a trial. You might be hoping to pursue a full-time academic role in the future. And last but not least is it offers you a break from full-time clinical practice and to improve quality of life. We all know how hectic and busy hospital work has become lately. Sorry. How to get involved in academia? There are really several pathways to get involved. This could be as part of your current clinical role. You might be an SHO or registrar in the hospital, and you can get involved with the academic team there in providing tutorials. You could be involved in research, such as audit or research within your own unit. And then you could also offer your help and help facilitate examinations, student examinations, or sometimes I've seen some of the registrars and SHOs helping out in the MRCPI examinations here in UHL. Another pathway is through university roles. Maybe a career academic where you're working full-time with the university as a lecturer or professor. These usually are standalone jobs. They're full-time university-focused posts or university-funded posts. And these usually require a higher degree. So at least a master's, usually a PhD or above to get these roles. In terms of university roles, other university roles available, these are tutor roles, and there are several roles available for tutors. I think people tend to think of the kind of tutor role that they're familiar with in the hospital, which is a clinical tutor taking students to bedside tutorials, but there are other tutor roles available, such as problem-based learning tutors and clinical skill tutors who usually work with maybe students in preclinical years, like year 1 or year 2. These, again, are standard alone jobs. They are full-time university-funded posts, and they can be based in the university or in the teaching hospital, depending on which year of medicine the student is participating. Along with that, you can also pursue a career in academia through postgraduate degrees. So there's such as masters and PhDs. Usually these are self-funded. So first, I'm going to speak about the tutor roles. So tutor roles are really fulfilling. Why would you choose it? For fulfillment, for career progression. Most of the time, I see the tutors spend around a year or 2 in this role as a full-time clinical tutor, and then they might choose to either go back to their medical field, say they might need some time to develop kind of their CV or learn new skills, or they might need time to complete some research or a higher degree. So this is one option that is available. The other thing that is great with these tutor roles is that you can work them around your own schedule, your work schedule. So you don't have to do it as a full-time, but you can do it as a part-time, such as we see here quite often in UL. There's a group of, say, example, general practitioners who work most of the week in their GP practice, but they might have a session or 2 of working as a tutor. So that might be around 3 to 5 hours a week in the university, and then the rest of the time they spend in their own clinical practice. And they find that combination works well for them, and of course, like they find teaching very satisfactory as well. You might choose a tutor role with the aim of a career shift into a full-time academic role. And you can choose it as well as a way to help fund your postgraduate degree, research, or completing membership exams. And as I mentioned as well, it can be a break from full-time clinical work. One point I would say is that for the tutor roles, you don't have to be based near or around the university or the main university hospital campus for the role. These roles can be within the university, within the main university hospital, but also in affiliated hospitals. So, for example, tutors that work with the University of Limerick, the main hub is the University Hospital Limerick in the city of Limerick, but there are tutors that might be in St. John's Hospital, Ennis Hospital, Portancala, Portlaoise, Clonmel, Kilkenny, Tullamore, that are all associated with the University of Limerick. So you might find a job that suits you and suits kind of your location as well, so where you're living. What does the job involve day to day? So this is a sample student schedule from our year 3 students, and you can see from the student schedule is that students most of the time, most mornings, they spend time with on the teams, on the rounds and outpatients clinic, and then they have usually some teaching commitment in the afternoon. So this could be student presentations, core curriculum lectures, bedside tutorials, professional competencies, attending medicine case conference, grand rounds, and simulation-based teaching on Thursdays and data interpretation. What you have to do as a clinical tutor, you have to make sure that all of this fixed teaching that is scheduled happens and takes place and the students attend it. But otherwise, you and a part of the team, it's very flexible. So anything here you see in green, that is free time to you as a tutor that you can use to do administration or do research. And as long as as those fixed teaching sessions occur and the students attend, really it's up to you. And the rest, it's up to you what you do the rest of the time. So it is very flexible, and you work as part of a team to make sure teaching is delivered. So what does a clinical tutor role involve? The biggest part of it is teaching. So that's organizing lectures, delivering tutorials that will be bedside or classroom based. But there are a lot of other elements. The teaching role the teaching part is a minimum of what the role involves. But then in terms of the rest, you're talking about kind of new skills that were or skills that were new to me over the past years were like student assessments. So organizing examinations, recruiting patients for clinical examinations, writing examination questions and correcting examinations. And something that you might think is as simple as writing a clinical examination question, you discover that it is really a skill. It's not something that is so easy. Like the examinations we write here at the University of Limerick, they probably get through, I'd say that the summer examinations are around April, May. The draft of the examinations is completed around November, be like November of this year. And it probably go through 6 reviews, internal and external, before an examination is signed off. So it is really a complex process. So that's a skill in itself. Other skills would be curriculum review, course improvements in terms of sites visits to different hospitals, see what is working well for students, what is not working so well. And earlier this year as well, we had a visit from the Irish Medical Council for a review of the course itself. And this happens every kind of 5 years. So this is, it was something like something that was eye-opening to me to be involved in part of this review. Other things that you might get involved in would be student specialty allocations. So in the summer break, we allocate all the new students to their academic supervisors over the next year. You act as a student support for students, especially those students that are struggling throughout the year. and involved also in clinical skills sessions for new doctors joining the university hospital group, especially interns. You do get time for your own educational learning, so reading and updating yourself, attending case conferences, grand rounds, national meetings, and learning new skills like simulation-based teaching. Most tutor roles will give you an option to attend clinics if you're worried or afraid that you might be losing on clinical skills as well. So how to apply for these? Application for tutor roles are very variable and depend on universities and the role itself. Generally, applications are open for January to April. And so if you're thinking about an academic role for July of next year, you probably need to approach your the current tutors and supervisors now to express your interest. It's always a good idea to keep an eye online for the university websites for any vacancies. So that's the first part regarding the tutor roles. And second part I'm going to talk about is postgraduate degrees. So why should you consider a postgraduate degree? Really the main aspects I would say are personal interest and career development. So a postgraduate degree would lead to a great improvement in your CV and boost your chances of higher specialist training. Along with that, you will learn a new and different set of skills from your clinical skills. One of the things that you need to decide on when you're choosing to pursue a postgraduate degree is the timing of it. Sorry, guys, I think someone has the mic on, if you don't mind.
I'm just screening them very quickly here to see whose mic is on. Sorry, Dr. Thamir, for the interruption.
No, thank you. Another question is, when is the right time to pursue a postgraduate degree in medicine? There is no right or wrong. You can pursue a postgraduate degree any time along your career pathway, from internship up to consultant level. So any time. But in my personal opinion, you probably should pursue a postgraduate degree after at least completing your SHO or basic specialist training membership exams. Because I think if you are pursuing a career in hospital-based medicine or community-based medicine, a non-academic role, I think the clinical experience counts more than your postgraduate degree. And for most jobs, they would like you to, in their application, they would like to see you have completed your membership exams. So I think at SHO level, BST, focus mostly on completing your memberships before thinking about a higher degree. So at a pre-SHT level, like if you're registrar starting off, this probably will help you with the application towards HST, and this would be like a good talking point, especially if you say you've done some research. If you're able to talk around that during a HST interview, that would be of tremendous help. And then if you are on the HST program, usually you have the option of taking some time off clinical work and maybe choosing to do 1 or 2 years of research or a higher degree within your specialty. So that option is available to you. And if you're on the alternative pathway as well, do consider doing completing a higher degree within your specialty. It just adds so much to your kind of knowledge, and again, you learn those new skills that will help you progress with your career. So where to study and research within Ireland? There are 6 medical schools. So there is RCSI, TCD, UCC, UCD, NUIG, and University of Limerick. And I've put them there in alphabetical order so no one gets offended, so you can choose any of them. And then apart from within Ireland, you could have the option as well. A lot of courses have gone online. So you have the option of distance learning within Ireland and abroad as well. So if you take a look at the courses provided and you don't see anything that suits you or suits your kind of career path, then you can always check So what degrees and courses are available? So you can have certificates, diplomas, masters, Doctor of Medicine, MD, and PhD. The certificates and diplomas, these tend to be taught courses. At master's level, it can be taught or research-based, or sometimes they combine both. So like a master's degree might have, say, 2 terms of a taught course, and then the last term, like term 3, might be a 2 or 3 month research project. MD and PhD, these are usually research-based degrees, and they can be clinical or lab-based. So research can be totally on the clinical side or within the laboratory. And you'll have the choice with your supervisor as to what you'd like to do. And the courses offered in Ireland have a very wide range. So you can have courses in medical education, biomedical sciences, various medical specialties, say cardiology, surgery, all will be accounted for there. Statistics, global health, policy and management, healthcare innovation, and the list goes on. So if you're thinking of a taught course, you probably should approach the course directors, and most of the universities will have an online link or an email that you can drop inquiries into to ask about the course itself, duration, fees, and so on. And I would say it's be very important as well if you're thinking about a particular course to be able to approach previous students. And what you are looking for there is the quality of the course itself, the workload involved, because you probably will have to be self-funding in this situation. So you want to know, would you be able to complete this course as a full-time student, part-time student, and would you be able to commit the hours to completing this course and finding it helpful. Another thing is whether this course was beneficial to the previous students, to previous doctors. Did it actually benefit them in their career progress? So those are all questions that you should ask before proceeding with the application. How long do these courses take to complete? So certificates and short courses usually are offered over several weeks or a few months. A diploma usually is max one year, and usually on a part-time basis. Master's courses usually tend to be around 1 year in full-time or 2 years part-time. And MD and PhD, you're looking at 2 to 3 or up to 4 years for a PhD. Within all of these options, you can have taught or research-based degrees. Some courses will require in-person attendance for at least part of the course. Some courses are totally distant learning, and again, part-time or full-time as well. So it all or a hybrid of all of the above. So it all depends on your schedule, so you can work it around your needs. And again, some courses do allow transition, so you might start off with a diploma and progress on to a master's, or start off with a master's and find that you're enjoying the work, you're getting the results, and you might want to switch to a PhD program. A big question is how much do these courses cost? Fees vary very widely between courses and universities, but you're looking at 2,500 to 13,000 per year for EU students, and then 5,500 to 27,500 per year for non-EU students. Funnily enough, like MD and PhD fees are usually cheaper than master's fees, but this is on per year. So the course itself overall would be more expensive, but per year it is cheaper fees than some master's degrees. And as you can see, that the non-EU postgraduate fees can be up to double EU fees in some cases. But there is some allowance made. So of course, if you have an EU passport, you can apply as an EU citizen for EU student fees. But even if you don't have an EU passport, if you have a non-EU passport, but if you are residing in Ireland, you've been working full-time for 3 of the past 5 years, you could be eligible and you're counted as an EU student. So do look at the academic registries and the details available there regarding the fee status as well. I have the link here for Trinity College Dublin, but all the universities will have a similar link. Another thing that can be helpful is that the revenue, they have a allocation for personal tax credits. Sorry. I think my screen is gone. Yeah, allocation for personal tax credits. So this is where basically the revenue would give you some tax credits and some tax relief towards your tuition fees. I think it has to be, there's a kind of minimal cutoff of €3,000, but anything beyond that there could be some compensation towards that. And the other thing is probably you should check this before you apply for the course, because there is a certain list of eligible courses that you need to be aware of beforehand. With regards to research-based degrees, those will be master's, MD, and PhD. You will require a clinical supervisor, or plus or minus a lab supervisor for your degree. You will require a research topic or research proposal before you start, and you're required to provide probably a source of funding as well. So all of these things take time to organize. So you need to start really early if you're thinking about pursuing a research-based degree. So approach your clinical supervisor early, think about the topic that you like to research and how to kind of set up kind of the experiments or the clinical research that you want to achieve. It is probably easier to complete research in a team which is already established, which has an already established team in research, such as that the research is ongoing, rather than starting like a new topic in an area where there hasn't been a precedent before. Research just takes a lot of time and needs a lot of patience in terms of reading, preparation, and there could be things like ethics approvals that can take some time to gain. So I think it would be wise to invest time beforehand in preparation before pursuing a degree in a research-based degree. You need to find a supportive team and talk to previous doctors and students who have worked with the team to see like the support that is available and resources that are available, and how long did it take them to complete their degrees. So to get a rough idea of the time it requires. Again, why do you choose research? To deepen your understanding. You get the chance to present at national and international meetings, to publish, and nationally and internationally again, and opportunities to network within the university or beyond. And it really does show an interest and commitment to your field. So skills learned during research, presentation, oral and posters, scientific paper reviews, scientific paper writing, hugely organizational skills, even setting up your days, weeks, in months actually in advance. So that is very helpful. Research skills, so these can be clinical skills or wet lab skills if you're actually doing laboratory-based experimentation. And then to improve your computer skills, so PowerPoint, Excel, all the statistics packages. Postgraduate courses, when to apply. So deadlines depend on the course and university, but usually are open around from end of year, around November, and closing date is between February and July. Most of the time for masters is around June. And just one word of advice regarding courses. Some courses have limited spaces. They might say 15, 20, 30 students, and they might have a rolling admission. And what that means is that they have first come, first serve admission. So they don't wait till they receive all the applications at the deadline, review the applications, and then pick the students. It might be rolling throughout the year, and once they reach the limit, that is it. That's the course for that year. So do try and apply as early as possible. So as you've seen that the cost of these degrees can be quite high in some cases, and you need to, of course, find a source of funding. This could be from HEC grants. It could be you might have to work some locums potentially. Other options would be to work in private hospitals, such as shift work, and this is a good option. I feel like it's they tend to be private hospitals quite flexible, so they might have a few different shifts. They might have a day shift or night shifts during the week or weekends. Say some of the students that we have here, they are studying, they're in college Monday to Friday, and then they might work, say, Friday night or Saturday, and that's the way they support themselves. Other jobs that are available, if you're lucky, there might be some within your specialty, it might be a job such as a research registrar. And this means that you basically dedicate yourself to your research, and maybe 1 day a week or 2 days a week, you might be involved in a medical clinic. Other jobs available include clinical trials registrars, and of course, as mentioned, the clinical tutor roles as well. Teaching and research, they're required for most job applications and training sign-offs. You're already probably doing parts of this in your clinical roles, your current clinical roles. You might as well get credit and formal recognition for it. You can get from your academic team certificates that you're teaching, you're giving tutors to the students. These will count towards CPD points, they'll count towards your training, and make sure that you get feedback from the students that you teach as well. If you are thinking about tutor roles, do express your interest to the clinical team, academic staff, and they might get you involved in an informal capacity as well. So in summary, academic medicine is very rewarding. It offers great variety and flexibility, and you really can work it to around your schedule and work it to your advantage. But you do require to plan early to avoid any disappointment. So most of these courses, you need to be thinking about October, November about them, start talking to your supervisors in order to get your applications completed. If you're still not convinced, there are some other courses available that are free. This is a course that is offered to the University of Limerick, and it's effective teaching, effective clinical teaching workshop series, and it happens on an annual basis between January and March. It's a free online course, counts towards 12 CPD points, but this is only offered to doctors that are working in the university group. So that would be University Hospital Limerick, St. John's Hospital, NS Maternity Hospital, and so on. But I'm sure that the other similar courses available in other cities as well. So you could keep an eye out for that. Finally, I'd like to say thank you for your attention. This is my email contact. If you have any questions, do get in touch.
Thanks, Dr. Thamir. That was very insightful presentation, and it did answer a lot of questions that was kind of brainstorming. We do have a couple of questions here in the group chat. I'm just going to read it to you very quickly. So the first question is, are stamp 4 holders generally considered for EU fees? That's a question from Reem, yeah.
Yeah, I think you will be, you should be eligible for EU fees. But I think it stipulates that you have to be working in three of the last 5 years. So if you're working full-time, you have stamp 4 working 3 of the past 5 years full-time in the country, yeah, that should be eligible for EU fees.
Okay, all right. Second question is from Amna, and she's asking online versus in-person MSc, any differences?
Yeah, it really depends on the course. Like some courses are purely online, some are in person. It really depends on the course. Like what I think Professor Hassan might have a better idea regarding that. But
Okay.
Yeah, thank you very much, Thamir. Thank you very much for the question. I think usually the way that the people develop the online courses is almost similar to the in person. It depends on two things: that the personal preference. There are people who would like to come and attend, and there are people who have time to come. And at the same time, there are people who cannot come, like the health professionals. So the university, when you apply for to be online, usually the university would like to make sure that the quality of teaching and learning will be as much as possible as if the people can come in to the university. Earlier in our countries, there usually we don't value the online courses, but here there is no difference in accreditation between online and in person, and usually in the certificate they don't write that, but so they don't write this online because they make sure that the quality is the same. But sometimes there are people, maybe when you want to attest your certificate, some of the countries in the Gulf, they ask for this. But in general, here in Ireland, and when I say in Ireland, that means in Europe, the online and in person depends on your preference, and there is no differences in teaching and learning.
Okay. All right. I think she kind of specified her question asking in terms of value of the certificate, and I think Professor Hassan has already answered the question.
This depends on the country where they are going to use that. But in the certificate itself, they don't write it. Unless those people, they ask you to bring a letter or something about something else.
All right. There's another question here from Nada. She's asking, would you still advise proceeding for an MD degree without previous research experience, only some certificates and diplomas?
Yeah, I mean, if it's an area that you're interested in, like I did an MD degree and I previously had no research experience prior to that and no research skills. I think it's great that you pursue it because you will learn so much. It's not just the kind of scientific aspect about it, but it's a lot of other skills, organizational skills, presentation skills. Like I just remember some of the scientists I worked with, like they would spend an actual full day just working on one PowerPoint slide. Like they have no issue with that. So that's just, yeah, it's a different level of skills.
All right. Just a last question here. Muaz is asking, what are the general requirements for postgraduate degree for someone from Sudan?
Yeah, I think that Muaz falls into the realm of Professor Elhassan again, and I think it might be part of his talk. So I'll let Professor Hassan address that.
Okay.
Okay, thank you very much. Muaz, if you don't mind, in my presentation, I'm going to speak about the application for postgraduates. And from that presentation, we're going to elicit what are the requirements.
Okay, fair enough. So there's no further question for now. So I think Professor Hassan can carry on with his presentation. And thank you very much.
Okay, thank you very much, Mohamed, for the invitation. And for my presentation, it's mainly about how can you pursue your application for postgraduate degree, and why do we mention that, or we would like to speak about that. I think it has been mentioned by Thamir that there is a high competition in applications. For example, last time for one of the courses here in University of Limerick, we received more than 300 applicants, and they submit complete applications, and the course should select a maximum of 20. So this high demand and high competition would like people to be well prepared for the application, application and during the application and post-application. Also, toward the end of this presentation, I'm just going to mention a few tips about how can you continue your studies as a working doctor. Before you apply, you need to do your homework, and I think that has been elicited and explained enough by Thamir. Only one point I would like to add here. If you are aiming at a research-based course, either master's or MD or PhD, when you speak to the supervisors, you need to have a full idea about what do you want to do. When you send an email for a supervisor, for example, asking for a research-based opportunity course with them, and you don't have, for example, an idea of research in mind, usually they will not be like enthusiastic in taking you. The other point, when you have a research idea that doesn't fit their field of training or their field of research. So if you want to communicate with anyone in any university, do some work in reading their papers, reading their research areas, reading their CVs. And when you have a clear idea about what do they work on, and you match it with what you want to do, then you can contact them. This is one of the important things. When you apply, you need to make sure that the program aligns with your professional interests and career goals. Because as Thamir mentioned, most of the time, this study will be self-funded. And it will be very difficult for you if you are in the middle of the course and you decide this is not for me. So better to make sure that this alignment is fine. Well, one of the other points that you need to consider when you apply is your schedule compatibility. Thamir mentioned that the application opened earlier, and usually the study starts in September. And I know very well that people in hospitals, they change the post in January and July. So sometimes when you apply, you feel that this is fine and my schedule is fine, but when you go to the job in July, it will not fit with the course that is going to start in September. So you need to have like a clear plan for yourself. Where am I going to be next year or next 2 years? Because most of the courses are either 1 year or 2 years, especially the masters. And the MD is 3 years. For the MD and PhD, you need to have more rigorous plans than for the masters and certificates, because this is 3 years. And year 1 will be fine, year 2 the work will be more, year 3 the work will be more and more, and year 4 in the PhD, sometimes you may need to have like complete time devoted for that work. So make sure that whatever the course you are going to choose or you are going to select is matching your career goals and your responsibilities. When you want to start application, one of the most important thing is to prepare the document that you need. One of the most important document that is needed when you apply for any level is the academic transcripts. And by the transcripts, we mean that the one that has your grades in any subject. It is not like the big certificate that we usually hang it on the wall. Because most of us has studied in countries outside Ireland. So they have to make like adjustment between the two systems and to find out is your level is eligible for this study or not. This cannot be done unless they have your marks. Most of the time, people who apply to the courses, they don't apply with the official transcript, they apply with the certificate. And what they don't be knocked out from the beginning. Usually they ask you to bring the transcript. If it is ready with you, that is fine. You are going just to upload it. But there are some people who they don't have it, or it was very old, or they don't know where it is. Because usually in hospitals, and I think in work in the hospital, they don't ask you about it. But in academia, they ask you about it. So make sure that you prepare it, because any day you are late, that means there are 1, 2, or 3 persons that are going to take your place. So the earlier that you are ready with these transcripts are the better. The second thing, you need to check your the English proficiency. I know that not most, if not all of you, they have the OET, but the OET is not considered in the academia. In academia, they consider IELTS, TOEFL, and other types of exams. But at the same time, there are some hospitals, some universities, and there are some courses. They value the OET if you are practicing medicine in Ireland for 13 years, because that's an indication that your English language is okay. You need just to make sure that your English proficiency is satisfied, because this is one of the areas that are very crucial when you apply for any academic program, which is your certificates, your transcripts, and then your English proficiency. One of the things that you need to be ready with is the financial documentation. Usually they don't require this in your application. But as Thamir mentioned, there is difference between EU and non-EU. Sometimes they either ask you during the application to upload it so they can know earlier whether you are EU or non-EU. Especially there are some courses where there is a specific ratio, not number, ratio between EU and non-EU. So if they want to make sure to determine this earlier, they ask you about the financial documentation during the application process, or sometimes they ask you later on, or if they don't ask you, you have to provide it so you can reduce the amount of money that you are going to pay. Because there are some courses where the difference between the EU and non-EU fee is huge. Maybe one year of non-EU is fine, but of non-EU can cover you the whole course, maybe for the whole 2 years. Also, usually they require you to provide a CV, and when you provide a CV, please, from my work experience as course director, I'm reviewing almost all the CVs for those who apply to us. Prepare a CV for your target program. Make sure that you are not using the same CV for the application for jobs and you use it for application for the programs, because it tells nothing. Sometimes you find people apply with a CV that is directed to the to a hospital name, which is this. They don't reject you, but it put like a barrier between you and the application, especially if the content of the CV is not meant. Sometimes there are some courses which require specific experience in research, for example. So you need to highlight this in your application. Also, make sure that you are highlighting all your clinical experience. Why is that? Because there are some courses which require minimum amount of years of professional experience. For example, the course on which I'm directing, we are requiring at least 2 years of professional experience. So you need to make sure that you are highlighting this in your CV. One of the things that people use in like preferring one applicant over another is the research interest and the research and publication. So if you have any relevant research that you have done, you have published, including the audit that you have done before, highlight it in your CV, because this will give you a bonus over other people who are applying. I think some of you have heard about the recognition of prior learning. In Ireland right now, they have a policy of recognition of prior learning. Prior learning means any learning that you have done before, or any work that can be evaluated as an academic work towards the course. For example, if someone would like to apply for a master's in research or in clinical research, and you have done a lot of research before, even sometimes like short courses, or you have published research, you can apply for with all those documentations, and that may reduce the time you need to spend in the course. So they can value your work and exempt you from 1 or 2 modules, for example, and then you just continue from module 3 or module 4, or even go to the dissertation directly. Or sometimes if you apply for the Masters in Health Professions Education, and you have lots of work in teaching of students when you are in Sudan or everywhere or anywhere, and you have documentation of this, and you have attended certificate in education before, you can apply with all those things for recognition of prior learning. And I think this is something people need to take this advantage. It is not there, I think, in all places, but in Ireland, they have started this from last year. There are lots of people right now, they are taking this advantage of the recognition of prior learning. All the courses, they ask you to write a personal statement. Why do you want to join this program? So there are a few things that I would like to highlight here. So please, when you write the personal statement, write it yourself, because the authenticity is the key for this personal statement. When people review the personal statements, they want to have an idea about your ability to write, your ability to think, because when you write something like 2 pages, that will reflect your thinking, and you will reflect why do you want to join the course. So it is very easy to identify the statements that are written by others, or the statements that are written using AI. And when we have this, again, this will devalue your application. It will not reject your application, but if there is someone who applied with a personal statement that is very authentic, then they will have a chance more than you. And when you write this statement yourself, make sure that the information in your CV match the information in your statement. Sometimes, for example, in the Masters in Health Professions Education, you have someone with a CV that doesn't reflect anything about their involvement in education. But in the statement, they say, I have been passionate in education since how many years, and I have worked with the students while I was a registrar. But this wasn't there in their CV. So even if you don't write it in your CV and you write here, you need to explain it. So maybe this is something informal that you are passionate about education, and you run like private teaching or tutorials for the students. You need to do this, because reviewing the papers in when you apply, really it's a meticulous process, and there are many people are involved in reviewing those papers, and there are many levels of reviewing those papers. So it is not like this a full dossier that we are preparing, but make sure that each word you write will be read. So and people are comparing between them. When you write your personal statement, articulate your journey, so or describe it. So why are you here, and why do you want to have the course, and how this course will help you in the future. This is very important because you will tell people that when they give you this chance of getting in the course, then you are going to help in the that is going to help in your career. But if we people in the course, they don't feel that you have a plan, then again, if someone has a plan, will have the chance more than you. As I mentioned to you, competition is very high. There are lots of people who are applying for any course you will think about. There are maybe also you have you know about this strategy of staying over. If you finish a master's degree in Ireland that has certain criteria, not all masters, you can stay for 2 years to work in Ireland after the masters. And a lot of people that are coming for this because they are not going only to go out with a certificate, but they are going to go out with a work experience. So this is something that makes the applications number or the applicants are very high, and you need to compete with this. When you write your personal statement, you need to write it in a way that it shows what you can do rather than just telling what I can do. For example, if you have done teaching before, you need to explain or describe what teaching you have done before, what involvement you have done before, not I can do it. Because again, I can do it, that is fine. But if there is someone who has already an experience, that will be an asset for the courses. Why is that? Because each course, they have like criteria for improvement. One of the criteria is that the level of their graduates. So if you have a graduate, for example, who can publish out of their and its accreditation, so they look at those qualities in their applicants. So make sure that you write all that you can do and you have done before. You have to be realistic that if there are any challenges that you are anticipating in pursuing this course, you have to describe them, and you have to describe what is your plan to overcome those challenges. Again, this will reflect the authenticity in your thinking toward the course. It is not just I want to come to this course to take the certificate, but I have a plan in mind for all those things. Also, one of the things usually people would require are reference letters. Sometimes they require two reference letters. Sometimes they require 3 reference letters. There are no like specific criteria for what do you want to write on those reference letters. But from the reference letters that we receive, few things that you need to consider. First of all, reference letters should be from referees, from human beings. A lot of people, especially the doctors, they send reference letter from the hospitals that they work in. So you find a reference letter from hospital, they just mention this is to certify that Dr. X is working with us from that date to this date. This is not considered a reference letter. We need a reference letter from your supervisor, from someone who worked with you, someone that you work with them for a long time. And sometimes, if there is like a very high competition, sometimes the course directors will contact your referees to speak with them about you. So when you select your referees, select those who can speak about your experience and skills. So you select those who know you. And usually provide them with your reference letter, because they need to know what are you doing and what is your progression. If for any reason they contacted them, they will give the right information about you.
if you want to prepare for an application, ask for a reference letter earlier, maybe 4 to 6 weeks before application deadlines. Again, as I mentioned in the transcripts, if you miss those reference letters and you don't provide them in the specific time, you are going to lose your chance, or your chance will be less. One of the things usually I tell people that if you want someone to write a reference letter for you, provide them with your CV and your personal statement. So they know very well who are you and what are you going to do and what is your thinking about the course. There are some courses that require applicant or some of the applicants to come for an interview. Prepare for the interview for the course. It's similar to the preparing for the interview for the job. So you need to study the curriculum of the course, the faculty members, their interest, research interest, definitely, and work interest, and what is unique about the course, because I will ask you why there isn't like a fixed question. Why do you want to join that course? So you need to speak about the uniqueness of this course and how this course is going to help you in your career. The importance of this course in your career is crucial, because that means you have a plan in mind and you deserve to have that chance. And usually when they do interviews, that means there are too much applicants who are almost, we can say, on the same level or at the same interview, so they can choose one or two of them, or according to the number that they are planning. Try to make like a scenario or expectation about what questions they might ask, and prepare your answers for those questions. And also, usually they will ask you if you have any questions for us. So prepare some of the questions that can demonstrate your genuine interest in the course. For example, how can this course help me publish while I am doing the course? Will the assignment are, for example, in an essay-based way, so I can use it for my literature review when I do the research? So ask those questions and prepare yourself with those questions, because this will give you advantage in taking the course. When you finish your application, you need to follow up with the status of your application, either through the portal, and you definitely, when you apply, you will have username and password for your portal. But the most important is the monitor and check for your email frequently, including the spam folders, because most of the applications came from like generic emails, either info@ or GPS@. So sometimes the emails, they recognize them as a spam and they take them to the spam folder. And we have lots of people who lost their chances because they didn't check their spam folder for any communication from the university. When you are accepted for a course, usually they ask you to submit acceptance payment. And that acceptance payment, the main aim is to show your willingness to join the course. So sometimes you pay 200 euros, 250 euros, and that amount of money goes towards your tuition fee later on. So, but this, usually they give you very short time to pay this, maybe 2 days, 3 days, based or differ from university to university. You have to make sure that you pay the amount of money in the specific time. If you don't pay it, you are going to lose your chance. So make sure that you follow your email, you follow your portal, mainly to accept the offer and to pay the acceptance payment. When you finish this, you are accepted. then it comes to the study itself. The most important and challenging things for you as doctors who are working is the time management during the study. So you need to have like a comprehensive calendar for all the commitments. There are assignments, there are deadlines for submissions of work, there are deadlines for working with groups, there are deadlines for reflections. We love deadlines in academia. Although Thamir mentioned that we have flexible hours, but we love deadlines. and if you go right now, for example, for the calendar, academic calendar, in any of the university's websites, you will find lots of deadlines and lots of dates. So we have lots of dates and deadlines, and usually those are like announced in the beginning of the module. So you need to make sure that the deadlines are there in your calendar and you know them very well. And sometimes you need to prioritize your actions by urgency. Which one is urgent? Which one doesn't need like your urgent attention, whether in your work or in your course study. One of the things usually I say to people that you need to block dedicated study time. And please, please, please don't say I will do this in the weekend or during weekend. If you say that, you are going to miss a lot of deadlines, because we as professionals, we have a lot to do during the weekends. So you need to like distribute the learning throughout the week. This, first of all, you will maintain a momentum, and you will put yourself in the academia momentum, which is totally different than the work momentum, by the way. And if you have like a regular time for study, after a while that will be like a habit for you. But if you postpone everything to the weekend, the products of your work usually will not be up to the standard, and you may need to like repeat it, or you may need to, or sometimes you will have low grades that doesn't satisfy you, and the problem with that will affect your progression in the course, and it may affect even your financial status, because if someone need to repeat a course, they have to pay money for that repetition. It's not like our most of our universities in Sudan, where we just come to the repeat and we sit for the exam. No, here you need to pay money, and sometimes you need to, if you repeat a module, sometimes you need to stay there for 1 year in order to put it for the exam. Especially there is a rule here, and it's everywhere, that you cannot go to the dissertation year in masters, for example, unless you are clear and you fulfill all the criteria for passing the modules in the first year or in the semesters before the dissertation. So make sure that you put yourself in the academia mood by having a devoted time every day for study, even if it is 1 hour, 2 hours based on the course. But don't put like 1 day that you are going to finish all the work, or don't put it only for the weekend. Just in conclusion, if you want to apply, start early, and this I think has been explained by Thamir. Stay organized, especially for the paper that they may require from you. So if they just ask for any paper, you have to upload it in the time. Build your network with the students who are studying with you, the graduates, alumni, so you can know the tactics and how can you go through the course. And definitely you need to maintain a balance with your work. So you cannot just go for the work alone, and then you come and find that you are under pressure to finish the coursework, or you will not also start like merging in the academia requirement, and then you will be in a trouble in your work. So if you do this, inshallah, things will be all right. وربنا يوفقكم جميعا إن شاء الله ويوفقنا جميعا. Thank you.
Thanks very much, Professor Elhassan. That was very helpful. And as I usually said, it's better to hear from the source directly. Professor Hassan, just to remind people, is a director of Master of Medical Education Profession in University Hospital of Limerick. So he's been through a lot of, he's a lot of experience in this field, and I think it's a very, very valuable presentation. Thanks again, Professor Hassan. We do have few questions here in the chat box. We're just gonna go through them very quickly. So Amna is asking, should I go for a medical education master or a master or an MSc of my interest, for example, like an oncology or dermatology?
I'm not thinking the only person who can answer this is yourself. No, I'm just like ليه as I mentioned, you need to think about why do you want to study the masters. Studying a master's means 2 years of study or a minimum, and when we say a master's 1 year, that means it's 12 months. So what do you want to do with that certificate in your career? A master's in medical education will help you very much in joining the academia with your certificate. So if you want to come to work in the academia as, say, assistant professor of medicine or assistant professor of oncology, then a certificate in medical education will help you because it will give you points over those who are only oncologists, for example. But if you want to do, if you are just planning for a clinical work and you want to advance yourself as oncologist, sometimes you will go for a master's in oncology and a master in a specific area that will help you in oncology. One of the areas that are very important here, not only in Ireland, but it became like a needy area all over the world, is the research and innovation. Maybe you can think about it because this is something also will give you a niche area that you know, and sometimes if you want to do a master degree, I advise you not only to search for master's degrees in colleges or faculties of medicine. Sometimes nursing colleges or nursing schools or health sciences, they provide very valuable masters that can help you. For example, masters in leadership, masters in healthcare management. Sometimes you don't have those masters in the School of Medicine, but you have them in the School of Nursing, you have them in the School of Business. And one of the most important things here in Ireland, most of the certificate, you have it from the university. So sometimes if you don't want the name of the school to be there, in most of the time, the name of the school where you have done the program is not there because most of the programs, technically, they belong to what we call GPS, which is the Graduate and Professional Studies Department. So you need to think about the masters, and the masters usually, why do we study masters? Because it opens you a window for a progression. So if you want to go in the education career, go for a master's in medical education. If you are aiming at being a leader and administrator, and you go for a master's in leadership because it opens you that window. If you want to do something in infection control, go for a master's in infection control. So it's not only about either education or my specialty of a clinical specialty, but about something else that I can do, something that I'm good at, and it can help me excel or being different than others. This is the aim for the masters. The PhD and the MD are the degrees that will define you. So if you have a PhD in medical education, then you define yourself as a medical educator. Because not only it's a PhD in medical education, but it's a PhD in medical education in that area. So you have your PhD is in assessment area, for example, or in curriculum development area, or in social accountability area. So the master's open to you a window, and the PhD puts you inside the room where the window was opened by the masters. Does that make sense, Amna?
Thanks, Professor Hassan. Just we've few questions here in the chat box. Dr. Muhallab is asking, what if you are an MSc holder from an English-speaking country? Is it considered an exemption for the PhD program?
If you speak about the exemption from the PhD from the English proficiency, that depends on the university regulations. And the definition of English-speaking country is different from university to university. There is a list of countries in each university where they consider certificate came from that country are exempted from English proficiency. To do this, you need to communicate earlier with the course directors. And I think that has been mentioned by Thamir, and that is very important area or the very important advice that you communicate with the course directors. Now, if you go for all of the courses websites, you will find the emails for the course directors there. Not only the emails for the courses, but for the course directors themselves. So now if you go to the Master in Health Proficiency Education, you will find my email there. So those things, you need to clear them earlier before you apply, so you are clear about what are the requirements for the application. But if you think about the PhD itself, the PhD here in Ireland doesn't require a master's. So you can apply for a PhD without having a master's in most of the PhD programs. Yes, there are some very few courses or PhDs that require you to have a PhD, to have a master's, but this is not like a unique requirement for our PhD. It is not like what we have in our country in Sudan, where master's is needed for a PhD program.
That I think that should be clear to you, Muhallab. We have another few questions here. So someone is asking about the benefits of obtaining a qualification in medical education for clinical practitioners. And they're also asking about the non-clinical jobs for the holder of such degrees.
I think that has been mentioned by
yes,
Thamir, that it opens you a window or a door to join the academia. So if you are a clinician and you have a master's in medical education, this can open you a door to go to the academia, and all the clinical tutors jobs mentioned by Thamir. Also, the medical education can take you to those jobs.
Someone else is asking where to apply for funding opportunities in Ireland for an MD by research. Whether they are database, they're asking also whether there are the database I could use to begin drafting a proposal, and if there is possible to join a program without already having a supervisor in place.
Usually, you cannot join a program without having a supervisor, number one. So if you want to have to join an MD program, or you want to do a PhD, the first thing you need to do is to search for a supervisor and to communicate with that supervisor, and the supervisor should agree on being your supervisor, and you agree even on like the general idea about the research, because this is this requirement in the application. For the funding, I'm not aware about all the fundings, but there is a very big funding program called the Irish Postgraduate Programs Scholarship, and this opens usually in September, and it opens this September. I think it opens this September, and its deadline is in October each year. So this is like a very large amount of money devoted by the Irish government for postgraduate programs. It's not only for PhDs, it is for PhDs, for masters, and for postdoc. Again, you need to have a supervisor first. You need to communicate with the supervisor first, and then you agree on a proposal, and you submit the proposal together as applicant and supervisor. The problem with that program is very competitive, because it covers not only tuition fee, it covers tuition fee, it covers per diem if you are spending few days here, it covers some sort of salary, and even in the for the postdoc, they can bring your family here. So it has like a huge amount of benefits. So if you want to apply for that, better to communicate, for example, a year before with the supervisor, and you work on developing your proposal and make it ready, and then you can apply for that. One of the things I would like to mention here, when you communicate with the supervisor, make sure that, as I mentioned, you know the supervisor well, not know him personally, but know their work well. And when you communicate with them for this opportunity of joining you or joining them as a student, you need to make sure that you are going to submit an idea that can compete other people who are applying to them. Because each year, I think any one of us, we receive not less than 15 to 20 emails from people who would like to make use of this funding program, and they would like to be among our supervisors. So the competitiveness, not only at the level of the application, but even pre-application. So if you want to apply for this program, and as I mentioned, usually open in September, you need to start communication with the supervisor maybe a year before. Are there any other funding opportunities? Usually, there are some help from this university for their students, maybe by offering them some jobs or offering them some help. But this usually when you are a student, not before. So you need just to make sure that you have the right understanding of the opportunities that are there. And as Thamir mentioned, usually in the university websites, you will find what funding opportunities are there. There is another way of funding, which are the research that has fund for supervisors. So there are some supervisors who can announce that they have funding for a PhD, for example. They have a grant for a research, and for that grant, part of it that they are going to recruit a PhD student, or they're going to recruit an MD student. So again, you need to follow the university website. For example, I myself, I have a funded PhD that, or partially funded PhD. We have announced it like 4 months ago or something like this, and the deadline is 3 days from here. So if someone would like to apply, so this is another source of funding that you can depend on. So these are the general source that I can remember right now, really.
Thanks, Prof, very much. Osman here asking, he said he finished 1 semester of medical education master in Sudan, and he want to apply here to finish his degree. He's just asking about the recognition of previous learning. Does it have a special process to go through, or it's kind of the same process of the master application itself?
Usually, it differs from university to university. Sometimes some of the university, they ask you to apply. Definitely, you need to apply when the application opened. You need to apply through the portal. But whether they have specific application site for recognition of prior learning, or you put your application or your notice that you want to have this consideration for your application in the same portal, this differs from university to university. Then what is going to happen, your application is going to be reviewed, and they are going to ask you for evidence that you have finished that master, whether it is from Sudan or from here, and they are going to ask you for detailed curricula that you have studied. And then what is going that they are going to match the content that you have studied with the content that is in this course, and they can decide whether you can be exempted or you cannot be exempted, or you can exempt from one module or from two modules. It depends on that thing. One of the things that people can do is right now also there is opportunity for micro credentials. In most, if not all, the Irish universities, they offer micro credentials. Micro credentials are modules part of masters. You can study it, study those modules, and if one day you would like to apply for that master's, you can apply with all the certificate that you have done, and then they will just evaluate which macro credentials that you have studied, and you can take your master's. Again, just as an example, our master's, we have 6 modules. 4 of them are offered as micro credentials, so you can study the micro credentials, the 4 micro credentials, and then when you decide to take the master's, you can just study those 2 modules and make the dissertation. Again, this is one of the things that you can think about if you don't have enough time, or if you don't have maybe enough funding. You can study your master's as micro credentials in the beginning, and then you take all your micro credentials towards the master's. It is again like the recognition of prior learning, but here definitely in the micro credentials, the process will be easy with the studying modules anywhere or everywhere. That this is a process where people can compare the content here and there.
Thank you, Prophet Hassan. Thank you very much. Unfortunately, guys, we're coming to the end of our session today. I want to sincerely thank the amazing speaker, Dr. Thamir Mahgoub and Professor Elhassan, for sharing their experience, their insight in such an important field in Ireland here, the opportunity for academic teaching experience and postgraduate degrees. Thank you very much, Doctor. Before we finish, Dr. Thamir, do you want to add anything or to comment on any field that has been mentioned?
No, let's say thanks very much for the opportunity. Just maybe one thing to add, I think, regarding Nada's question about funding. Sometimes medical teams have already established research links with universities, and they can bring their own grants and funding that is available to them. So if you talk to your supervisor, they might be able to guide you to kind of different pathways to work towards funding as well, to your clinical supervisor. I just want to say thank you for the opportunity, and thanks to Professor Hassan. That has been amazing and so informative. I did an interview around 2 months back for a job, and I didn't get it, and I wish I'd spoken to you earlier. So thank you very much.
Thanks again. Thanks, Dr. Thamir. Thanks, Professor Hassan.
Thank you very much. Thank you.
Thank you, guys. And I'll see you again, hopefully, in the next session. Thank you very much.
Thank you.
Appreciate it. Thanks. Suzanne, I think